Hello and welcome to this video, the second in this series where I'm talking about different methods of pain management. Now, pain, as chronic pain, as anyone who has suffered from it knows, is something that can, if you let it, can take over your entire life. But there is a very, very large psychological response to pain. And to be honest, pain management sits right at the forefront of everything to do with the mind-body interface. There is no one magic bullet for how to deal with pain. What I want to go through in this video is looking at some of the psychological and mind-based techniques that can be very helpful. And the first technique I want to talk about, and if you know what I do, no one will be the slightest bit surprised to hear me talk about mindfulness. What is mindfulness? Mindfulness has its base in Buddhism, and it's most often associated with mindfulness meditation. And if you go online, you can Google and you can find loads of mindfulness tracks every Friday, or at least once a week, not necessarily on Friday. I actually do a longer Facebook Live where I lead a Tai Chi Qigong set and end up with a mindfulness meditation. Mindfulness is actually about all to do with keeping your mind in the present moment. And if you've got chronic pain, that seems very counterintuitive, because if you've got chronic pain, you would think that thinking about the pain would actually be almost the worst thing you could do. But actually, it's not. Because when you have chronic pain, the natural thing to do is to distract yourself from it. And an awful lot of the fear that goes with having chronic pain is, how bad is the pain going to get? Is the next move going to hurt me? And that sort of thing. So by becoming aware of the pain, you can actually get to know it. And when I do a mindfulness meditation that's about helping with control pain, I will often use phrases like, use your breath to explore the area that's giving you pain and discomfort. And I will again often use the phrase about, imagine that you enfold that area in a gentle, loving breath. When you are very aware of your pain, you actually get a much more realistic idea of how bad it is. When you've got chronic pain, sometimes seems that it takes over your whole body. When you actually turn towards the pain mindfully, you can very often find that the area of pain isn't as bad as you thought it was, and that it isn't as constant, that the sensations rise and then fall. So in that way, the mindfulness can be useful. But also, when you are mindfully aware of your pain, you are mindfully aware of what makes the pain better and what makes the pain worse. So you can actually, by using that mindfulness, you can actually help to reduce the level of pain that you're suffering. Now, another technique that can be used for pain is what looks on the face of it totally bonkers. It's a thing called the emotional freedom technique, where you tap at various places and make various gestures in the face. If you want to know more about it, you can either PM me or again, you can go online and you can find lots of EFT videos. The thing is, when you always have a setup phrase for the EFT. And if you have chronic pain, then the ideal setup phrase would be, even though I have this pain, I still totally, completely and utterly love and approve of myself. The emotional freedom technique, as the name implies, helps to take away some of the emotional threat of something. It's often used to help people quit smoking, often used to help people deal with food cravings and things like that. Areas where quite often people feel they don't have any control. And very often when you have chronic pain, there is this feeling that you don't control it, that you've got no control over what you're feeling. The one thing you do have is control over how you react. And what the emotional freedom technique can do is actually help take away some of that emotional content so that you are calmer. And when you're calmer and more relaxed, do you know what happens? Yep, your pain actually gets less, because so much of what makes pain worse is the fear and the tension and the anxiety. The last technique that I want to talk about is hypnotherapy. Now, if you're having hypnotherapy to help you manage pain, I would be asking you maybe to visualize your pain, give it a shape or a color, or maybe ask you to measure the intensity of the pain, maybe with a dial, a gauge of some sort. And I would be asking you to, okay, this is your pain. Imagine the shape, imagine the colour, see the dial, whatever image you choose. And then, while you are under the in the trance, the hypnotic trance, I would then get you to actually visualize the gauge coming down, the colour changing, the shape changing to something that's acceptable to you. Again, this is about giving you control over something that fundamentally you probably you don't have an awful lot of control over. Hypnotherapy techniques can be very effective, but to be honest, like all the techniques, they do need a lot of practice. But the interesting thing with hypnotherapy techniques is when it's been used in practice, and it is pretty effective, is that if you use, say, a scale, you say you've got a scale, or your pain's on a scale of 0 to 10, where 10 is the worst pain you can imagine. Obviously, you want the pain to come down to the lower end of the scale. Interestingly, there are people who do not want the scale to get to 0. There is a level of pain and discomfort that they're actually reasonably happy with. And that brings me to another thing that I think is worth mentioning, which is trying to eliminate pain completely, isn't practical and may not be a good idea. Because your pain, for most people, especially if it's a joint pain, is a symptom of something that is wrong. And the chances are that what is wrong is something that has developed quite possibly because of things you've done, because of things you've eaten. Maybe if you've got joint pain, maybe you need to shed some weight. Maybe you've been eating the wrong sorts of foods. Maybe you've been standing in a bad posture. That's something I will cover more when I do my inevitable video about Qigong in pain management. But the pain is a symptom that there is something wrong. And this doesn't work for everybody, by the way. But if in your heart of hearts you know that actually that level, that pain is, and the problem is caused by something that probably over many years that you have in a way done, then a low level of pain is a reminder that you still need to keep working on correcting what was wrong. In my case, I have hip pain, and I know I need to lose a certain amount of weight, probably a fair amount of weight. But also I know that I've had postural issues over many, many years. And so when I get a twinge of pain, that's actually a reminder to me to, right, okay, make sure you're sitting or standing in the best possible posture. Okay, if anything that I've said here has sparked your interest, then you know how to contact me. If there's something specific that you'd like me to cover in a future video, then again, please contact me. I will look forward to seeing you next week.